Most people assume cataract surgery is a one and done deal. You go in, the cloudy lens comes out, a new one goes in, and a few weeks later, you're seeing things clearly again. Done. That's the version most patients picture when they finally get their surgery date. And honestly, that relief is real. After months or years of struggling with blurry vision, glare, faded colors, the idea of a clean fix feels incredible. And here's the thing. The surgery itself really is that quick. The recovery, though, well, that's a completely different story. And the timeline surprises almost everyone. There's a distinction that most surgeons don't explain well before you go in and can cause a lot of unnecessary anxiety after surgery. Surgical healing and visual stabilization are not the same thing. And confusing the two is where a lot of patients actually get frustrated. Surgical healing is a physical process. Your incisions need to close, inflammation needs to settle down, and the implanted lens needs to stay in the correct position. That part typically happens within the first few weeks after surgery. Most people are back to normal daily activities within a week or so and driving again within 24 to 48 hours. And their surgeon is happy with how things look usually at the 1 month follow-up visit. That's the sprint part of the whole equation. But the visual stabilization, actually seeing the way you're going to see things long term, that can take much longer and involves the processes the eye and brain are doing quietly in the background to make it happen. So, in the first few days after surgery, it's completely normal for your vision to be inconsistent. Things might look sharp 1 hour and hazy the next. That's mostly due to some swelling and inflammation inside the eye. The eye just went through a procedure, and the tissue reacts the way tissue always does. It swells, and this can distort vision temporarily. Most of that settles within a week or two. Then comes the adjustment phase, and this is the one that people aren't necessarily prepared for. Your eye may have spent years, possibly decades, working with a natural lens, and now there's a synthetic implant sitting in place. The lens itself doesn't adapt, but the eye and brain do. Your visual cortex is essentially learning to interpret a new optical system, and that process isn't always instant. Some patients describe it as a feeling almost like the prescription isn't right in their eyes, or that things are clear but somehow still off. And it has a biological explanation. It's not failure, it's the brain catching up. And so this adjustment period is typically more pronounced for people who may choose premium lenses, the multifocal or extended depth of focus lenses, because those lenses split light in ways that create multiple focal points or extended focal point, and the brain needs more time to sort this out. But even with a standard monofocal lens, the neuroadaptation process still can take time. There's also the question of corneal healing. The incisions made during surgery, even though they're very tiny, disrupt corneal nerves on the surface of the cornea. And those nerves play a role in tear production and eye surface stability, which is why so many patients notice a dry, gritty, or fluctuating vision symptoms in the weeks after surgery, even if the dry eye problem was never really an issue before or was pretty stable before surgery. So when you layer all of this together, the inflammation, the swelling, the brain adapting, the corneal nerves healing, the lens settling into its final position even, you start to see why recovery is a much bigger window than most people expect going in. And once you understand this baseline, the two most common long-term complications start to make a lot more sense. So I want to now talk about a complication that catches more patients off guard than almost anything else in the long-term recovery picture. It's called a posterior capsule opacification, PCO for short. And the reason it blindsides people is that it feels exactly like the cataract is coming back. The vision that was clear after cataract surgery slowly starts going hazy again. The glare returns, the colors seem washed out. And you might start to think, did something go wrong? Did the surgery fail? Is this really happening again? Well, the good news is the cataract is not coming back. That's the first thing to understand. Once your natural lens is removed, it can't regrow. The cataract cannot come back. But here's what can happen. When your surgeon removes the cloudy lens, a thin membrane is left behind called the lens capsule. Think of it like an envelope. The original lens sat inside of it, and now the artificial implant sits inside of it too. So this capsule is very important because it holds everything in place. And in some patients, over time, the cells on the back wall of that capsule, because it is natural tissue in your eye, start to multiply and migrate. And they can form a layer of cloudy tissue right behind the implant lens. That cloudiness is what you see when your vision starts to blur again. It's a membrane, or some people call it a scar tissue, but is not a cataract. But the effect on your vision can be very similar enough that the two can feel identical from your visual standpoint. This happens more often than most patients realize. Depending on the study you look at, what type of lens was used, somewhere between 20 to 40% of cataract surgery patients can develop a significant PCO within 2 to 5 years after their cataract surgery procedure. So while it doesn't happen to everyone, and the rate has come down over the last several years to decades due to improved lens implant design, it's still common enough that every cataract surgery patient should know it's a possibility before they even have surgery. And the timeline varies. Some people notice changes within a year. For others, it takes 3 or 4 years, sometimes longer. Sometimes people never have symptoms. And the progression is usually gradual, which is part of why it can be easy to miss at first. You might just think your glasses aren't quite right anymore, or that you're tired, or that the lighting in your house may be dimmer or changed. Then one day you realize you can't read the TV guide clearly from across the room like you could a year ago, and that something might actually be wrong. When it becomes significant enough to treat, the treatment is generally straightforward. It's called a YAG laser capsulotomy, YAG standing for yttrium aluminum garnet, which is the type of laser used. Your ophthalmologist uses the laser to create a small opening in the cloudy capsule tissue. It's typically done in the office, and it takes maybe 5 minutes. There's no cutting involved, and most patients notice visual improvement within their vision within a day or two. And it's good news, it's typically a one-time procedure. The opening created by the laser doesn't close back over, so in most cases, once it's done, it's done. It's also typically covered by insurance, which is good news given how many cataract surgery patients eventually need it. But here's the part that matters beyond the clinical logistics. The emotional weight of it. Patients who went through cataract surgery recovered, felt grateful for their clear vision, and then watch it slowly fade again, and they can feel very blindsided. And this frustration is completely valid. Many of them say they were never told this was a possibility. So when vision starts deteriorating again, patients can assume something went wrong, or that their surgeon made an error, or that their results didn't hold. But none of this might be true, actually. Because the psychological impact of the experience is real, it could have been significantly shortened with a single honest conversation before surgery. That's really the through line here. PCO is manageable, the YAG procedure works well, and vision does come back. But the gap between what patients expect and what actually happens over time, or years, that's where the frustration lives. Of course, there's other complications that can happen after cataract surgery that may not be related to PCO. So that's why if your vision gets blurry, it's very important to see your eye surgeon to make sure it's not another condition that might need other treatments besides a laser therapy. And so while PCO is the most common long-term complication, there's another one that tends to show up much earlier in the recovery process, and it tends to linger in ways people don't anticipate. What could this be? Well, it's dry eye, of course. Dry eye after cataract surgery is one of those things that's easy to dismiss as a minor nuisance. And then 3 months later, you're still dealing with burning, gritty, light-sensitive eyes and wondering why you didn't feel prepared for this before surgery. And unfortunately, it's not rare. It's actually one of the most common complaints in the post-operative recovery period. And for a lot of patients, it's a thing that can actually affect daily quality of life far more than expected. And here's why it happens. When your surgeon makes the incisions to access your cataract lens, those incisions pass through the cornea, the clear front surface of your eye. Running through the corneal tissue are tiny nerves that play a much bigger role than most people realize. One of their jobs is to signal your tear glands to produce tears. So when those nerves are cut or disrupted during surgery, the signaling system gets interrupted. Your eye temporarily loses some of its ability to sense it's dry and even respond to it. So tear production can drop, and the surface of your eye can become unstable, and you end up with classic dry eye symptoms even if you've never had dry eye problems before surgery. So these symptoms: burning, stinging, a feeling like there's sand in your eye, vision that fluctuates throughout the day depending on how well your tears are coating your eye's surface. These tend to peak somewhere around 1 to 3 months after surgery. And that's often when most patients feel frustrated because they're past that initial healing phase. They feel like they should be seen well by now, but instead they're dealing with uncomfortable eyes and vision that still feels unreliable. The good news is that for most people this does improve, but the full resolution can take 6 to 12 months, and for some patients it lingers even longer than that. Now, this is worth paying specific attention to if you're a woman in your 40s, 50s, and 60s. Dry eye is already significantly more common in women during perimenopause or after menopause because estrogen plays a role in tear production and ocular surface health. So, if you already have some degree of dry eye going into cataract surgery, even if it's mild, even if it's managed, there's a real chance that surgery is going to make it flare up. Your baseline dry eye doesn't have to be severe for this to happen. Even what we call subclinical dry eye, the kind you might not have noticed much in daily life, can become very noticeable after surgery when the corneal nerves are disrupted. This is actually why pre-surgical dry eye assessment matters so much, and that helps set the expectation for what to expect after surgery. Because if your surgeon knows you have dry eye before surgery, they can treat it aggressively beforehand to get the ocular surface in better shape, which tends to improve both the surgical outcome and the post-operative recovery experience. So while walking into surgery with a compromised tear film isn't ideal, and some evidence suggests it can affect the accuracy of the measurements used to choose your implant lens power, when it comes to managing dry eye after surgery, there are several layers. Artificial tears are our starting point. Preservative-free drops used frequently throughout the day, not just when the eye feels uncomfortable. Warm compresses help loosen the oils in your eyelid glands, which are part of what keeps tears stable on the eye surface. Omega-3 fatty acids, whether through diet or supplements, have some evidence behind them for supporting tear quality over time. And for patients with more significant dry eye symptoms, prescription drops that target the underlying inflammation that drives chronic dry eye disease rather than just lubricating the surface may be important to use too. And these can take weeks to months to reach their full effect, which is another reason why starting management early makes a lot of sense. Additionally, for patients with meibomian gland dysfunction, where the oil-producing glands in the eyelids are blocked or degraded, in-office treatments like LipiFlow or IPL therapy can also help restore gland function in ways that maybe drops alone can't. And one thing to be transparent about here, some of these treatments aren't necessarily covered by insurance. And if dry eye becomes a persistent problem, the cost of managing adds up quickly. That's worth factoring into the full picture of what cataract surgery recovery actually looks like financially, not just medically. So after everything we've covered, the swelling, the neuroadaptation, the dry eye, the possibility of PCO down the road, the obvious question is this: when is your vision actually done changing? When can you trust what you're seeing? Most surgeons will tell you 4 to 6 weeks, and technically that's accurate for surgical healing. The eye is physically recovered, the implant is stable, the incisions should be closed. So from a structural standpoint, the procedure is complete. But 4 to 6 weeks is not the same as your vision being finished, and that distinction matters a lot more than patients are usually told. Think about all the layers that are still actively changing past that 6-week mark. Your corneal nerves, the ones disrupted during surgery, are still in the process of regrowing. This can take many months, and until they're more fully restored, your tear film will remain somewhat unstable, which means your vision may be variable. Your brain is also still in the middle of neuroadaptation, still learning to process what the new lens is sending it. And if you chose a premium lens, like a multifocal or an extended depth of focus design, that adaptation process may be longer and more demanding than a standard lens. The brain has to learn to automatically prioritize the right focal point depending on what you're looking at, and that isn't something that necessarily happens in 4 to 6 weeks. So, for some patients with premium lenses, that process can take up to 6 months. For others, it may be even closer to a year before they feel like the lens is working the way it's supposed to. And there's also the question of where you started. If you had a strong prescription before surgery, say you were very, very nearsighted or very, very farsighted or just had a lot of astigmatism, then your visual system has spent so many years compensating for that when you remove the cataract and place a corrective implant in there to change it, it changes the optical input so much that the brain really needs time to compensate for a new prescription that for decades was completely different. And this recalibration does take time. And the patients with high prescriptions often notice this adjustment period more acutely, and they need more patience with it. This is exactly why rushing to get new glasses very early after surgery is a mistake. It's tempting, especially if you're still not quite seeing right, even at your 6-week appointment, to think a fix is a new pair of glasses or a tweaked prescription. Sometimes if you peeled up well enough, it is. But if your eye is really still dry and it's just actively inflamed, your corneal surface is still fluctuating, which means the measurements taken for a new prescription may not be accurate enough. And so you could end up with glasses made for a prescription that changes again once the dry eye settles down. Most surgeons may recommend that you could get glasses prescription, a finalized prescription, maybe a month after surgery. It could take up to 3 months or longer to get a more stable one. And here's the honest version of the timeline when you put it all together. In the first few days to 2 weeks, you're dealing with surgical inflammation and initial adjustment. From weeks 2 to through 6, most of the physical healing is happening and vision is generally improving. And from 1 to 3 months, the dry eye often can be at its worst and then finally stabilize. Patients start to feel frustrated because they expected to be further along. From months 3 to 6, the corneal nerves are still recovering, dry eye typically stabilizing and hopefully improving, and neuroadaptation is well underway. And the good news is from 6 months to a year, sometimes beyond, the vision continues to refine, especially with premium lenses, and stable vision gradually becomes clear. So for some patients, what they're seeing at 12 months genuinely looks different from what they saw at 6 weeks. Not necessarily dramatically, but noticeably. More comfortable, more reliable, more like they had hoped for after surgery. And this trajectory is normal. It's not the one anyone tells you beforehand. Some people may reach this after 1 to 2 months, but other people might take longer. So knowing this timeline changes something important. It changes the conversation you should be having with your surgeon before you ever schedule the procedure. Most pre-surgery consultations focus heavily on risk, infection, swelling, the rare serious complications. What they often skip is the long-term reality. So here's what you should actually be asking before you go in. First, ask about dry eye specifically. Ask your surgeon whether they do baseline dry eye testing before cataract surgery. This should be standard. Measuring your tear film quality, checking your meibomian glands, assessing the health of your corneal surface before anyone touches it. If your surgeon looks at you blankly or says it isn't necessary, that's worth noting. A compromised tear film before surgery affects the accuracy of your lens calculation measurements and makes your post-op recovery harder. Knowing your dry eye status ahead of time means you can treat it aggressively in the weeks before the procedure and give yourself a better starting point. Second, ask what their post-op dry eye protocol looks like. Is it just use artificial tears if you need them, or do they have a real plan? Follow-up appointments specifically to assess the ocular surface, access to prescription drops if needed, and even referral to a dry eye specialist if things don't resolve. The answer tells you a lot about how thorough the long-term care is going to be. And third, ask about PCO rates with the specific lens they're recommending. Different lens materials and designs have different PCO rates, and your surgeon should be able to speak to that. Doesn't mean you should necessarily choose a different lens based on the number alone, but you do deserve to know and a surgeon who's comfortable having that conversation with you. And if you're considering a premium lens like a multifocal or extended depth of focus or even a toric, ask directly about neuroadaptation, what it looks like with that specific lens. How long does it typically take? What percentage of patients need an enhancement? What happens if you don't adapt well? Premium lenses cost significantly more out of pocket, and the adaptation process is real. You really need to go in with clear expectations, not assumptions. And finally, ask for the full recovery timeline, not just the surgical healing window. If the answer you get is, you'll be great in 4 to 6 weeks, push a little further. Ask about dry eye timelines. Ask about when to get a final glasses prescription. Ask what signs would warrant a call to the office. A surgeon who gives you a real, honest, layered answer is one who respects your ability to handle the truth. So, the initial question, is this a marathon or a sprint? Surgery is the sprint. The recovery is absolutely the marathon. And the finish line looks different for everyone depending on which lens they choose, whether they've had dry eye going in, and whether PCO develops years down the road or months. And finally, none of this is meant to be discouraging. Cataract surgery has genuinely high success rates, and for most people, it dramatically improves their quality of life. But the outcome is most reliable when you go in informed. Knowing about PCO, knowing about dry eye, knowing why vision takes time to fully settle. Be your own advocate. Ask the questions. Push for a pre-op dry eye assessment. Don't accept vague timelines. Thanks for watching the video. Please give it a thumbs up, share it if it was helpful, and I'll see you in the next video.